Greetings to President Gregorio del Pilar of the National Research Council of the Philippines and the members of its governing board. Greetings too to NRCP Executive Director Marieta Sumagaysay, to members of the NRCP, and to our presenter, Dr. Enrique Oracion, who is a regular member of NRCP, Division of Social Sciences, and Director of R&D in Silliman University. To all NRCP members all over the country, colleagues, ladies, and gentlemen, good morning. Elderlies or persons 60 years old and above are considered a vulnerable population who are more prone to illnesses. As the vulnerability to illnesses increases, the need for greater access to health care facilities and treatments also increases. Every year, the amount spent by the senior population group is increasing. A big portion of these expenditures are shouldered by the senior citizens themselves or their households. This is nearly 60% of total health spending. The rest is financed by social health insurance schemes like PhilHealth, domestic revenue-based or central government schemes, and other financing such as HMOs. Apart from the cost that the healthcare needs impose, we should also look into the quality and sufficiency of the healthcare benefits and privileges they receive from the public and private healthcare providers. That is, if these healthcare benefits suffice the needs of the elderly, and if the elderly are satisfied with the health services that they have been receiving. In the Philippines, the number of older men and women is growing faster than the population growth. In year 2000, there were 4.6 million senior citizens, or 6% of total population. In 2020, there are 9.4 million senior citizens, representing 8.6% of the total population. We cannot help but ask if the health services are increasing as fast. Older people need care and support. More so, many older people struggle with poverty. And now, the impact of COVID-19 may just too heavy a burden. Today's Policy Forum will look into this related concern of our senior citizens. I am happy that the National Research Council of the Philippines has been regularly conducting policy fora, an avenue by which it delivers its mandate of being an advisory body to government. The Council has been conducting a yearly policy forum that would help the policymakers craft laws and policies. This may lead to the enhancement of existing laws and policies using research findings and evidences. I remember NRCP conducted a policy forum on unraveling air pollution effects in the air we breathe, where it provided basic data for better air quality management for use by environmental authorities and policymakers. The advisory included key information necessary for implementation and review of the effectiveness of policy-level changes intended to air pollution reduction, which is an initiative of the government. Indirectly, this may impact on senior citizens who are vulnerable to respiratory diseases. The NRCP also had a research-based advisory towards stepping up efforts to stimulate the protection and sustainability of Lake Lanao, one important resource for communities around the lake. I would surmise that the elderly attach their lives' meanings to the lake. The Mindanao Policy Forum, held on August 28, 2018, concluded with the agreement for NRCP to spearhead the conduct of an annual Lake Lanao Policy Forum in collaboration with the Mindanao Development Authority, the DOST regional offices, and the MSU system and other agencies which may have contribution to the conservation and sustainability of Lake Lanao. To this, I may add that the Council can also look into the social science dimension involving the elderly. Today, Dr. Oracion of Silliman University will present his research findings on healthcare services for seniors, the value and adequacy in Metro Dumaguete. With the present healthcare benefits and privileges received from healthcare providers and businesses, are these enough or are they insufficient? Are healthcare services provided by the government preferred by the senior citizens compared with the private healthcare providers? I hope that in this forum, policy recommendations generated by Dr. Oracion will be validated. Hence, help the policymakers to address the health needs of our elderly, improve the coverage and quality of services they have been receiving, and help them access these services at an affordable cost. Thank you and congratulations to Dr. Oracion.